Good evening, everyone, and welcome to today's session. I hope you're all charged for a battle and you love to win 40,000 rupees worth of online MBBS.com subscription by cracking everyday 3 quiz tournaments. So now, doctor, I can see 39 players online. And I want to see almost 200 playing every day, every night, every morning, and every evening. Please invite your friends across the WhatsApp and everywhere and make this a viral phenomena. आज देखेंगे कौन जीतेगा 40,000 rupees cash prize at the end of this quiz tournament. Let's make the great beginning, doctor. I hope you're all ready. Type kahoot.it and enter your screen name and the PIN number. 1, 2, 3, start. Punch your answers, doctor. Punch your answers. A 70-year-old male admitted last night due to behavioral difficulties at home. The patient had been having rapid changes in his consciousness levels. At times, he seemed to respond to both the visual and auditory hallucinations. He has some rigidity and guide disturbances as well. What is the most likely differential diagnosis for him? Oh, there is almost 25 seconds of time lag. Very good. 11 of you are right. This is a classical case of Lewy body dementia is what you need to remember. Vaishu is on the top, followed by Manasa. Today it is going to be ladies' evening. And Mohan, Akhilesh are trailing behind. So doctor, what is the point that you want to learn? The clinical features of the Lewy body dementia, what are they? Progressive cognitive impairment, apathy, depression, hallucinations, extrapyramidal signs and Parkinsonism and neuroleptic sensitivity, falls, syncope, and spontaneous loss of consciousness is what you need to remember. Now the next question for the today's evening, doctor. These are all the features of Ganser syndrome, except I'm so happy to see 43 online students. Even if you are late, no worries. You have the PIN number, 111818. 111818 is the PIN. But those who punch the answer faster is the one who is going to reach to the top. So the Ganser syndrome, what is your answer? So very good, doctor. Ten of you are right. Approximate answers. Typically, when you go to the Vivavos in the MBBS exams, they will ask you a question. Where is the heart? You will say, heart is in the chest, sir. But actually, examiner want to know whether it is an anterior mediastinum, middle mediastinum, or posterior mediastinum. So Ganser syndrome, if you happen to ask a prisoner while doing interrogation, how many legs the horse is having, he will say 3 legs. So he will give approximate answers, amnesia, pseudo hallucinations. They're all the part of the Ganser syndrome is what you need to basically remember. So that brings money to the top, followed by Guna Sundari, Navina, Chandra, and Vaishyu. Rad is the highest climber. Excellent, doctor, excellent. So, Ganser is considered to be a dissociative disorder. Approximate answers and clouding of consciousness, somatic conversion, pseudo hallucinations, and a subsequent amnesia. These are all the components of the Ganser, is what you have to remember. Now comes the next question. Very good. We are nowadays becoming viral. I'm so happy. 48 online students. Please post in your WhatsApp group of your classmates about the upcoming quiz. More the players, more the merry. Spardhaya vardhate vidya. The competition expands the knowledge. There is a pride in becoming a topper and winning a 40,000 rupees worth of online MBBS.com video library. A 33-year-old female has been diagnosed with post-traumatic stress disorder after witnessing a road traffic accident. She wants to get well as soon as possible. So, which is contraindicated in the management of post-traumatic stress disorder is the question to all of you. Boom, boom, boom. Who is going to give me the correct answer? Very good. 6 of you are absolutely right. Eye movement desensitization and reprocessing. Exposure therapy. If you are taking mock tests with Dr. Murali Bharadwaj, every Sunday, full-scale grand tests. If you are playing 3 tournaments every day, morning 10 a.m., afternoon 2 p.m., and night 10 p.m., every day 3 subjects in 6 days, all 19 subjects done. So every week there is 1 cycle that you are finishing. And in 52 weeks, we conduct 1,000 tournaments, quiz tournaments. And every day, each quiz tournament, there is a topper, and the topper gets 40,000 rupees worth of online MBBS.com video library, 65 full-scale grand tests, 1 lakh PowerPoint slides of notes, daily live online interactive session access, everything to make you the topper. So don't forget to join Super 1000 group of Dr. Murali Bharadwaj and show the world that you are born to become a winner. So doctor, that brings Manasa to the top, followed by Mani, Karuna, Gunasundari, and Navina. Very good, doctor. So you need to remember, there are certain guidelines called NICE guidelines. So, if the symptoms of post-traumatic stress disorder occur more than 3 months after the trauma, then you need to offer trauma-focused psychological treatment. That's called trauma-focused cognitive behavioral therapy, eye movement desensitization and reprocessing. Whereas, if at all the onset of symptoms of the post-traumatic stress disorder occur within 3 months after the trauma, then you need to give trauma-focused psychological treatment. Debriefing is contraindicated. Now comes the next question. Anorexia nervosa. That slimmy, that bony, that completely emaciated female patient comes to you. What are the various hormonal changes in anorexia, which is not correct with regard to the hormonal changes? What happens to the T3, cortisol, growth hormone, corticotropin releasing hormone, etc., etc., etc.? Boom, boom, boom. Punch your answers, doctor. Very good to see 50 online students. I'm so happy for bringing your friends. Tonight, 10 p.m., we have a pharmacology quiz. Take it as a challenge, mukabala, and then win the prize. Very good. 17 of you are right. Decrease in growth hormone does not occur. Whereas increase in corticotropin releasing hormone, decrease in T3 levels, increase in cortisol, they're all the true statements about the hormonal changes in anorexia nervosa. Very good. Karuna is coming very closely to take the crown from Manasa. Very good, Manasa. Good going. Psychiatry is very interesting. After general medicine, psychiatry is the next best subject. Probably if I would have not got a seat in MD general medicine, of course, there is no question of not getting seat. When you go for entrance, Kali ek cheez hona hai. I am the king and I will only win. That kind of confidence you have to build. My second preference would have been psychiatry. A 30-year-old woman is known, case of schizophrenia. She presented with altered mental status, severe stiffness along with rapid eye blinking, unusual head and neck movements. She is having peculiar movements simulating the doctor's movements. She is afebrile and creatinine kinase is normal. Which signs will not be associated with her condition? First of all, what is her condition? You have to be 100% sure to diagnose. What is her condition? Then, which sign is not associated with that condition? You will be able to answer. Very good. 18 of you have correctly answered, doctor. Astasia, abasia will not be there. But ambitendency, Gegenholten, echolalia, they're all the features. Very good. Navina reaches to the top. I'm so proud of you, Navina. Of late, you are studying very well. Recently, Navina joined our subscription of online course. And I hope she will give a good feedback about how this onlineMBBS.com video library is helpful in her preparation. So, doctor, what the condition I described in the clinical vignette is catatonia. Catatonia typically will show stupor, posturing, negativism, stereotypy, mannerism, echolalia, echopraxia, logoria, etc., etc. So catatonia can be component of schizophrenia, catatonia can be component of mood disorder, etc., etc. Now, doctor, a 45-year-old female has been dependent on medication to treat her anxiety. Recently, her psychiatrist removed one of the chronic medications that she used to be taking, and that led to a withdrawal where she was showing autonomic hyperactivity, malaise, weakness, tinnitus, grand mal convulsions. What is the most likely possibility in her given case? What is your diagnosis, doctor? You have to be 100% sure. Very good. So ideally, questions you need to see it on the laptop screen on the YouTube. That is a better way. And also remember, very good. So that brings Karthik to the top. Oh my God, Navina has gone 5 positions down. No worries, no worries. Minu is one of the fastest climbers. So, doctor, it is a benzodiazepine withdrawal syndrome that she is passing through, where there is autonomic hyperactivity, malaise, weakness, tinnitus, grand mal convulsions, etc., etc. Now, doc, which is not a bad prognostic factor for the individuals who are having anorexia nervosa. Neha Narang is asking, can't it be serotonin's withdrawal syndrome? No. Once more, I want to tell you, Neha, that there are 30 hours of video lectures, nearly about 50 lectures on most high-yield topics, video lectures in onlinemmbbs.com video library. Please take every opportunity to subscribe and do a revision. So, doctor, which is not a bad prognostic factor for the anorexia nervosa. Very good. Female gender is not a bad prognostic factor. A long duration, onset at older age, and previous hospitalization for anorexia, metabolic disturbances associated with the anorexia, that is a bad prognostic factor. Very good. Manasa is on the top. So, doctor, what are the list of bad prognostic factors for anorexia nervosa? One of the favorite topic of the examiner, if you look at the previous AIMS PGI question bank, first rank symptoms of schizophrenia include all this except what are the first rank symptoms of schizophrenia? There is no question paper without schizophrenia. If you are dreaming for a question paper, NEET PG or FMGE, without schizophrenia, that is only a hallucination or a delusion. So what are the first rank symptoms? Everything, anything about schizophrenia, you have to be 100% sure, doctor. Punch, punch, punch. Whoever punches faster is going to be the topper. Very good. First rank symptoms of schizophrenia. I think most of you will correctly answer this question. I know that. "17 of you rightly answered. Very good. Very good, doctor. Sorry, 9 of you rightly answered. Delusional perception, delusion of passivity, thought insertion, thought broadcast. They're all the first rank symptoms, not the delusion of persecution is what you have to basically remember. That keeps Manasa on the top. Chandra is one of the fastest climber. Once more, I want to tell you, doctor, you need to respect all 19 subjects. A lot of people ask me a question. Hey, are you crazy? You teach all 19 subjects with the same amount of fluidity. How is it possible? I tell them only one thing. My profession and passion is general medicine, no doubt about it. Any day reading Harrison or Davidson is like a happy experience. But as a student, You should not develop an aversion. Hey, psychiatry I don't like, preventive medicine I don't like. No, that's not acceptable. Because ultimately, Jo Jeeta Wahi Sikandar. So when as a student, if passionately you are reading, you are expected to read 19 subjects. I want to set an example and lead you by example, leadership by example, that when I can be able to review 19 subjects, teach 19 subjects for you, as a student, you too can read, you too can master, you too can avoid aversion for all the 19 subjects. So that is the reason, Doctor, onlinembbs.com YouTube channel, please promote it among all your friends. Every day, 3 subjects, 3 tournaments, quiz tournaments, and 3 toppers will come out, and each will get 40,000 rupees worth of onlinembbs.com video library. So every week, we finish all the 19 subjects, 3 into 6. That way, we get 50 weeks in a year to get a chance to compete, know ourselves, what is our potential, where are we lagging behind, and go back to the onlinembbs.com video library and do the revision. So, doctor, you need to remember a very important thing. What are the Schneiderian first rank symptoms? Please recite along with me. Auditory hallucinations, delusion of passivity, that is thought insertion, thought withdrawal, thought broadcasting, made feelings, actions, impulses, made impulses, somatic passivity, and delusional perception is what you need to emphatically remember. Which is not a feature of pseudobulbar palsy? This is a beautiful question. So what is meant by bulbar palsy? What is pseudobulbar palsy? Typically in the pons, if you do a midsection at the level of the pons, you are cutting down the corticobulbar fibers, not just on one side, bilaterally. So typically the bulbar nuclei are controlled from both the sides corticobulbar fibers. So unless you cut both bilateral corticobulbar interruption, unless you do, you can't get UMN features. In the case of the bulbar nuclei, that is called pseudobulbar palsy, where you get everything exaggerated. In UMN, what happens to reflexes? All reflexes become exaggerated. So that is the reason now you have a clue. Most of you are going to correctly answer. There is no normal jaw jerk, but an exaggerated jaw jerk. That is what you see in pseudobulbar palsy, is what you need to remember. Very good. Corona, kuch na kuch corona is on the top, followed by Vaishu, Karthik, Navina, followed by Mohan. Excellent. So, doc, bulbar palsy versus pseudobulbar. Bulbar is lower motor neuron, whereas pseudobulbar is upper motor neuron. The tongue is flaccid in bulbar palsy, but spastic because it is upper motor neuron type in the case of the pseudobulbar palsy. Donald Duck speech is a typical feature of pseudobulbar palsy. That is, inappropriate laughter or emotional incontinence is the feature of pseudobulbar palsy, is what you need to remember. If you want to know more, if you want to do more revision of psychiatry, you have 35 hours of video lectures in the onlinembbs.com video library, where both theory and MCQs, last 15 years of AIMS, All India PGI, JIPMA, and NEET PG revision had been done in the subject of psychiatry. Please call our helpline and right away grab your subscription. What is that anatomical correlate? Anatomical correlate of this form of memory where the visual association cortex and auditory association cortex are involved. Which type of memory these two association cortices are involved is the favorite question of the examiner. Very good. So 8 of you are correct. Short-term memory is the place where the visual and auditory association areas are associated. Karthik was one of our previous toppers in the daily quiz tournament. Very good, Karthik. Anju Thomas is the highest climber. So, doctor, short-term memory, the anatomical correlate of auditory verbal short-term memory is in the left parietal lobe. Whereas the visual verbal short-term memory is there in the left temporo-occipital area is what you need to ultimately remember. A 50-year-old businessman was killed in a road traffic accident while crossing the road. His son turns his anger and plans to take revenge on the negligent driver. Everybody will have that anger, but he converts that into energy of taking over his father's business and making it big. So this kind of a defense mechanism, what is this called as? One MCQ in psychiatry invariably comes from defense mechanisms. So I hope you are all having that 953 topics, high yield topics. So, very good. Let me see how good you are in defense mechanisms. Only 5 of you are right. Sublimation. It's called sublimation. A lot of people thought it as reaction formation. No, no, no. That keeps Karthik still on the top. So, doctor, you should remember. The son has transformed the unacceptable, destructive impulse. Isko maar dena hai mujhe. Kind of a feeling that he is having into an acceptable and constructive form. This is called sublimation. So whenever you are angry, when you look at that Shah, Datta, Anantanarayanan textbook, Park textbook, I should kill it and burn it instead of doing that. Finish the revision on the online mbbs.com video library. Okay? That's the best sublimation reaction for you to master these subjects. Now, doctor, a 5-year-old girl is scared of monkeys like we were all scared of our teachers in first year MBBS. When she goes to the zoo, when we had gone to the first year anatomy theater, she behaves aggressively on seeing a monkey, as if she is about to attack the monkey. So which kind of defense mechanism best describes this situation? Punch your answer, doctor. So, she behaves aggressively on seeing a monkey, and she behaves as if it is about to attack. Very good. 18 of you are right. Reaction formation. Reaction formation is the kind of defense mechanism which you have seen. Karthik is still on the top with 5,291 score. Come on, Manasa, Gunasundari. You have to take away the crown. Running very fast. So, doctor, The girl behaves in an opposite manner to hide her underlying fear of the monkey, and this is called exhibiting reaction formation. You are seeing a 60-year-old woman who is referred by her general practitioner for depression. She complains of 6 months history of worsening progressive dysphagia. There is no improvement. Her husband confirms her history. What is that the patient most likely suffering from? Worsening progressive dysphagia, depression, no improvement, 60-year-old. That should give you a very important clue about the diagnosis. Punch, punch, punch. Very good. 25 of you have clean bold but a very good common sense answer, though it is not a right answer. Moderate depressive episode with somatic complaints. But 5 of you are absolutely right to hit motor neuron disease as a diagnosis is what you need to remember. Very good. Manasa is quickly running to catch the crown of Karthik. Let's hope Manasa is going to be the winner of 40,000 rupees. Let us check. Karthik, you have to see. No match fixing, please. So, Dr. Motor neuron disease. Depression does not cause progressive worsening dysphagia. That's the point you need to appreciate. When a 25-year-old female was asked to describe her pre-morbid personality, she says that she is someone who always finds it tough to make a decision. What is that particular personality disorder that she is likely to have? What is that personality disorder that she is likely to have? Punch your answer, doctor. 25-year-old female describes her pre-morbid personality. Yes, doctor. So, types of personality disorders is one of the favorite questions, doctor. So, on the onlineMBBS.com video library, you have under every video the PowerPoint presentation, which is like a notes, almost 1 lakh PowerPoint slides of notes you are having, which is more than enough as a good notes. I'm so happy. 22 of you have correctly answered dependent personality disorder. Very good. Karthik and Manasa, Mohan are in a close street fight. Let's see who is going to be the winner in this boxing show. Very good. So, if someone has a dependent personality disorder, they have a tremendous fear of being left alone. Mujhe chhod ke nahi jao na, please. That is dependent personality disorder. If you come to reading room, I will also come. If you sit on last bench, I will sit there. If you are opening the Harrison's 10th page, I will open 11th page. If you don't come to the reading room, I don't come at all. What shall I do? Initially, you will fall in love, but later on you feel, oh my God, what is this kind of a emotional burden on me? So, but when there is a love, you can manage any kind of personality in your better half and appreciate the merits of the other's personality. That is the most important, essential thing of an unconditional love. So, doctor, the last question is going to decide, is it Karthik, is it Manasa, whoever answers first. Punch, 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 punch. Patients with catatonia tend to present with the following symptoms. What is an exception? Patients with catatonia presents with the following symptoms. What is the exception? Punch your answers, doctor. The faster you punch, the greater the chance that you are on the top of the quiz tournament. Once more, tonight we have pharmacology quiz. A edge of the seat, excitement. Don't forget, but join. And tomorrow, Sunday, full-scale grand test. Please subscribe to 65 full-scale grand test series of online MBBS. And every Sunday morning, 9 to 12, you have an online test available, 300 MCQs, just like the real exam. Afternoon, post-lunch, 2 to 4, you have a discussion. Earlier, we used to give over all that discussions, everything openly in the YouTube, but nowadays, we want more students to join and subscribe. So there is a private live broadcast to all the subscribed students. So be part of that by buying a subscription of onlinembbs.com video library. Abhi aa gaya. Oh, Karthik, you are still reigning. Karthik is still reigning the top. Maybe Karthik's girlfriend, Karthik will be giving the 40,000 win that he had in this tournament. So, doctor, the time to give the medals. Mohan! Manasa! Karthik Jindabad! Very good, very good, very good. And we have Gunasundari among the runners. I'm so happy and proud of you. Once more, Karthik, you know the routine. Take a screenshot and send it and tell me on whose name you want the activation to be done for the entire video library. Right? So, Manasa and Mohan, very good performance, and all of you for coming and joining this contest. And those who got second, third, fourth up to 10th, by tonight, if you buy, you will get a 90% off just by paying 4,000 rupees. You will be able to still get the entire video library, mock tests, everything, right? So that is the reason. Please don't dishearten if you are in second or third. The beauty of the game is to be in the game, to participate, to fight, and to get excited and getting challenged. And that excitation and challenge should drive you back to go back to the books and do the revision. Thank you very much. Signing out, always, forever. Spending time with you guys. The young generation of doctors of the new India is always a pleasure for me, right? And because of you, I'm also studying 19 subjects every week. And that is the most beauty part. So please don't forget to once more come at 10 p.m. for the pharmacology quiz. हम सब मिलेंगे, हम सब खेलेंगे, हम सब मिलके चाय पिएंगे. Till then, enjoy a great evening.